You have noise from the background? What is that? Is it outside? It is outside. Yeah. At a time like this?
You're not supposed to stop that, right?
No.
Vacuuming is important. Oh my God.
Leave it to you, Bob. You know me. All right, we're gonna start. Good afternoon, everyone. And happy summer. We've just about come to the end of it. I can't believe it. Okay, I digress. We're going to dive right into our stated agenda. First, we'll vote on the following finance items. A preconsidered resolution sponsored by Councilmember Justin Brannan would establish a new 40-year Article 11 tax exemption for 14 4- and 5-story buildings in the districts of Councilmembers De La Rosa, Dinowitz, Sanchez, Feliz, Stevens, and Salamanca. And a preconsidered resolution also sponsored by Councilmember Brannan approving the new designation and changes in the designation of certain organizations to receive funding in the expense budget. Next, we'll vote on the following land use items. 47 Hall Street rezoning will facilitate the redevelopment of a site containing 10 existing buildings in Councilmember Hudson's district. The proposed redevelopment will include both new construction and renovation to provide approximately 611 housing units, with approximately a quarter of the units being permanently affordable under MIH Option 1. It will also include over 280,000 square feet of commercial space and up to 60 accessory parking spaces. 347 Flushing Avenue will amend the zoning map to bring an existing commercial building into zoning compliance in Councilmember Ressler's district. 236 Gold Street rezoning will facilitate the development of a new 14-story mixed-use residential and commercial building with approximately 114 housing units, 29 of which will be permanently affordable under MIH Option 1, also in Councilmember Ressler's district. 42-11 30th Avenue rezoning will facilitate the redevelopment of a site containing an existing 1-story grocery store in Councilmember Caban's district. The new 5-story mixed-use residential and commercial building will provide approximately 28 housing units, up to 8 of which will be permanently income restricted under MIH Options 1 or 3. It would also include additional commercial floor space for the store. An application to facilitate the redevelopment and enlargement of Lenox Hill Hospital in Councilmember Powers' district, which has served the city since 1869. It will include 475 single-bed patient rooms, modernized operating rooms, and other clinical spaces, and the creation of needed ambulance bays, which will allow the hospital to provide optimal patient care. The modified proposal reflects years of community input and includes changes to reduce the maximum building height. As part of the project, the hospital will make significant investments to the southbound entrance of the 77th Street subway station, including for ADA accessibility. And the Midtown South Mixed-Use Plan, which is the largest residential neighborhood rezoning in 2 decades and will deliver nearly 10,000 units of housing, over 2,800 of which will be permanently affordable in Councilmember Bottcher and Powers districts. Through negotiation on the rezoning, the council secured over $448 million in economic development investments to support the garment district's fashion and garment industry, as well as community benefits and infrastructure improvements to the Midtown South area. New Yorkers are facing a citywide housing crisis, which we all know, and we must confront it by advancing housing solutions and creating more homes with a focus on affordability. We're proud to pass another historic rezoning today that builds on our successful record. I now invite Councilmember Bottcher, there you are, to the podium to speak about this rezoning in his district, and we will hear from Councilmember Powers as well after I outline his legislation that is also being voted on today. Councilmember Bottcher.
Thank you very much, Speaker Adams. So we identified the fact that in Midtown Manhattan, there's whole swaths of area that don't permit any residential development at all. There's swaths of Midtown that don't permit new housing. And one of the most transit-dense areas of the country. So we have been working the last year and a half collectively with our community on a rezoning to fix that and permit residential uses in Midtown Manhattan, but 30% of the new housing must be permanently affordable. So today, we are delivering over 9 8,500 units of housing with over 2,800 permanently affordable homes right in Midtown. And a key priority of ours was to achieve this rezoning while also not harming the garment industry in the garment district. And we've achieved that with a series of zoning protections and $122 million in investments in programs to invest in that industry, and a new brand, Midtown Made, with a new one-stop shop website and a new campaign to help support the garment industry. We've also won some incredible investments in public space in our district. Broadway Vision, Broadway from 21st Street under 42nd Street is going to be transformed into a grand pedestrian plaza that will rival those of Barcelona and Paris, with the streets being raised up to sidewalk levels, with kids first play districts, areas for passive and active recreation, public art. It's going to be the town square for this neighborhood, this Midtown neighborhood that will accommodate tens of thousands of new residents. We were able to win a 34th Street car-free busway. Huge achievement. We did a race last week, Councilmember Powers and I. Councilmember Powers was on the bus. I walked. I won by 7 minutes. Okay? That's not cool. So we're fixing that. 34th Street will be a car-free busway, allowing New Yorkers to get across town quickly. We've won millions and millions of dollars of investments in local parks, schools, infrastructure, landmark protections for historically significant buildings in the district. I want to thank Speaker Adams and her team for their leadership. When I joined the City Council in 2022, one of my true hopes was that we would be a council that generated large amounts of housing and addressed our housing crisis. And that's what we've done under the speakership of Speaker Adams again and again and again, and we're going to continue doing so to address the affordable housing crisis. I want to thank the Land Use Committee, everyone who made this possible. This is what addressing the housing crisis means, actually producing huge amounts of affordable housing, 2,800 units. We're voting on it today. Thanks so much.
Thank you. Today, we will also vote on the following pieces of legislation. Introduction 998A, sponsored by Councilmember Keith Powers, would codify New York City's cooling center program, requiring the Commissioner of the New York City Office of Emergency Management to designate cooling center locations where there is a heat-related emergency, and the designation of at least 7 cooling centers per 100,000 residents. The determinations of where to locate cooling centers would be required to consider factors such as areas where vulnerable populations reside. The bill would also require NYSEM to provide information on how the public can submit feedback about their experiences at cooling centers or report on any challenges accessing them. I now invite Councilmember Powers to the podium to discuss his bill and his land use actions. You got a lot to talk about.
I can do a lot. I can do it all. Thank you, Madam Speaker. We have 3 things we're doing today that I'm really proud of. As mentioned, we're voting on a bill that would help codify and to expand the city's cooling center program. Honestly, anybody who's spent a day in New York City recently knows how hot it has been, and for many of our vulnerable populations here in the city, it's really important that we have good and functioning and well-resourced cooling centers. So our bill will actually codify the program and make sure that there is a good allotment all over the city so that no neighborhood, no community is left out of having access to the really important, sometimes life-saving cooling centers. We're also voting on the modernization of Lenox Hill Hospital, my district, which has been a 6+ year process of ensuring that we can modernize a really critical, important hospital in my district, while also making sure we can make changes to address many of the community's concerns, like construction timeline and impact on that neighborhood. And we will be bringing that to a vote as well. And as Councilmember Bottcher and the Speaker mentioned, we have a big plan here for Midtown South moving forward, which is the results of years of work together and with our borough president and this council staff to modernize and to move forward a new housing plan to make sure that Midtown South, which, believe it or not, you can't live in today, is actually a neighborhood that can become 24/7 and become a residential community. We're solving three things at the same time. We're solving a housing crisis in this city with 10,000 new units, with 3,000 affordable units. We are solving a crisis around our commercial office buildings, which need help, and there will be obviously many that will come forward to convert, while also making sure that we protect and invest in the fashion and garment industry, which is so critical for the city's economy, and in this area is home to so many of those businesses. I just want to say that we started in a great place because we had Councilmember Bottcher, Borough President Levine, and I was proud to join them to say we want to do this. We want to make sure we modernize Midtown South and bring housing there. That was an important first step, but the rest of the steps were challenging. And to get to a place where we can save and invest in the fashion industry, expand our transportation options, address the commercial vacancy crisis, and address all the different hurdles, utilize new state allowances to build more density in places like Midtown. To me, that is a great success. I want to give Councilmember Bottcher a lot of credit. We had to go to the very end of this process to make sure we could get the investments in the fashion industry and the garment industry to save and protect them. And that does not happen without Councilmember Bottcher's demands to stay at the table until the very end. So I want to give him a lot of credit. I think he has his measuring tape from earlier somewhere, but has earned it. And to everyone and the staff here at the City Council as well for helping us fight to the very end to get what we want. And finally, as mentioned, as a bus rider on that M34 constantly, there is no reason. No offense, I feel like Eric Bottcher is probably a fast walker, but there's no reason Eric Bottcher should be able to walk faster than the bus in New York City, or anyone. But losing by 7 minutes was pretty embarrassing, so I'm really excited by the ability to move forward a bold transportation plan for the core of Manhattan here as well. I want to congratulate Councilmember Bottcher, and very much looking forward to seeing it happen today. Thank you so much.
Good stuff. Okay, Resolution 986, sponsored by Councilmember Crystal Hudson, would recognize August 14th, 2025 as the 90th anniversary of Social Security and commemorate August 14th annually as Social Security Day in the City of New York. Introduction 1056A, sponsored by Councilmember Hudson, would require physicians and nurses employed or contracted with the Department of Health and Mental Hygiene and working in public schools through the Office of School Health to complete annual competency training on health concerns related to sexual orientation, gender identity, gender expression, and sex characteristics. I invite Councilmember Hudson and her platform to the podium to discuss her legislation.
Thank you. Let me get my platform here.
Leave it there.
Anybody is welcome to use it, by the way. It's here for all. Good afternoon, and thank you, Madam Speaker, for giving me the opportunity to speak about Introduction 1056, which this body is voting on today. Despite serving 915,000 children, our city's public school system does not currently have any requirement in place to ensure that medical personnel, like school nurses or physicians, have training in the unique needs of LGBTQIA+ kids. When young queer people have access to healthcare professionals who understand and affirm their identities, they are less likely to experience severe mental health challenges and more likely to receive care that directly meets their needs. Intro 1056 would require physicians and nurses employed by or contracted with the Department of Health and Mental Hygiene who work in public schools to complete an annual LGBTQIA+ competency training, which would focus on health concerns for the community, like information related to gender-affirming healthcare and a list of referrals and resources to help medical personnel connect students with such care. This bill came out of the LGBTQIA+ caucus's policy agenda to address concerns that school personnel were unfamiliar with new developments facing LGBTQIA+ medical care. I'd like to thank the many of the groups working with queer young people, including the Ali Forney Center, Transformative Schools, VNS Health, NICLU, who helped improve and support this legislation, and also want to wish everybody a happy Social Security Day. Today is the 90th anniversary of Social Security, and at a time when Trump and his administration are trying to dismantle resources like Social Security, it's that much more important for the City Council to stand up and make clear that today, August 14th, in perpetuity in New York City, will be Social Security Day. Thank you.
Bless you. You can leave it there. I'm
Okay.
sure. Karen, are you going to need this too?
There you go. I'll stand.
I know my members.
Yeah. You can use it too.
I can use it too? Okay, I'm good. Okay. All right. Next, we will vote on several bills to provide information on patient rights for transgender individuals. Introduction 628A, sponsored by Public Advocate Jumaane Williams, would require the Department of Health and Mental Hygiene to design signs describing the rights of transgender patients, including information on an individual's right to be referred to by their preferred name, title, gender, and pronoun, and to make such signs available to hospitals in the city. DOHMH would also be required to coordinate with hospitals to identify the services offered to meet the specific needs of transgender individuals, including gender-affirming health care. Introduction 629A, also sponsored by the Public Advocate Williams, would require the DOHMH Commissioner to report annually on training provided by hospitals to medical staff regarding medical care for transgender individuals. I invite the Public Advocate, who we consider him still our neighbor upstairs in the City Council with all these bills he's passing lately, to the podium to discuss his legislation.
I'm going to use this. No, I want to get taller.
There you go. You're welcome.
Yeah, I got to go try out. Thank you.
Yeah, exactly.
Doing good work.
Anytime.
I like this height. Eric, this is a good height, man.
You can see the stars up there.
Peace and blessing, love and light to everyone. Thank you, Madam Speaker, for your leadership on all of these issues. And, while we have a really divisive president who's helped by conservative media and lawmakers doing their best to deny communities, and in particular for these bills, deny transgender communities rights to serve, to play, frankly, even to exist, to access the gender-affirming medical care they deserve. Across the country, trans New Yorkers are facing preventable obstacles to basic equitable health care. Here in New York, we want to try our best to fix it. As the federal government targets the trans community, it's essential that local governments enhance protections committed to justice, inclusivity, and equity. I'm hoping that we start to learn the lessons of the importance of local government to protect from these kind of horrific things that are being done. The trans community deserves equitable access to health services, be able to receive the treatment without fear of discrimination or the burden of education and explanation. While we fight the bigotry of the federal government against TG and CB Americans, we have an obligation to do what we can here at home to confront the inadequacies that stem from implicit bias and explicit lack of training on transgender issues. So we introduced these bills about 3 years ago after hearing stories from the community, stories that denied their rights and their humanity. And I think what we're learning now is more acutely than we may have wanted to is that all of our rights and all of our protections are interconnected. And so I'm very thankful that the Speaker and the Council took up these bills. In a healthcare setting, especially in emergency, you shouldn't be trying to educate folks at the same time you need emergency care. That's a big burden and a barrier for some. And we have heard from transgender New Yorkers who simply won't go to the doctor, won't go get health care for fear of being mistreated. And we want to make sure that ends. And so I'm very excited about these bills. Intro 628 required DOHMH to distribute and post signs on an individual's right to be referred by a name, a title, gender, and pronoun in city hospitals, and listed conspicuously, and also post transgender-specific services in facilities on one's website. Also coordinate with hospitals to identify the services offered by any such hospitals to meet the specific needs of transgender individuals. Important note, this particular bill doesn't require any specific services.